What is normal pressure hydrocephalus? A 65-year-old woman is evaluated for worsening urinary urgency and incontinence. The patient has had no abdominal pain, dysuria, or changes in urinary frequency. On several occasions, she has urinated involuntarily, which she attributes to an inability to walk quickly to the bathroom. The patient feels unsteady while ambulating and walks slowly with small steps. Her family also reports that she has become forgetful and has difficulty planning and executing various activities that she used to perform regularly. Medical history is notable for hypertension. Neurological examination shows impaired attention and short-term memory. MRI of the brain reveals chronic white matter changes with no infarction, hemorrhage, or mass lesions. There is diffuse ventriculo-megaly with no sacral enlargement. Which of the following is the most likely underlying cause of this patient's urinary incontinence? The correct answer is E, stretching of descending cortical fibers. This patient with impaired memory and cognition, unsteady gait, and urinary incontinence has ventriculo-megaly without sacral enlargement on MRI, which is characteristic of normal pressure hydrocephalus. Normal pressure hydrocephalus can occur due to decreased absorption of cerebrospinal fluid by the arachnoid granulations. For example, fibrosis from previous cerebral inflammation or bleeding, with gradual accumulation of cerebrospinal fluid in the ventricular system. The lateral ventricles expand, resulting in normal intracranial pressure and stretching the descending cortical fibers, corona radiata. Interruption of these pathways, along with impairment of cortical and subcortical function, leads to the classic triad of normal pressure hydrocephalus symptoms: dementia, gait disturbance, urinary incontinence. The cerebral cortex, through the Micturition center, regulates the Micturition reflex, which is an autonomic spinal reflex mediated by the neurons in the sacral spinal cord. In normal pressure hydrocephalus, the lack of cortical inhibition results in detrusor muscle hyperactivity. This leads to urinary urgency, which can be worsened by gait abnormalities that limit a patient's ability to quickly get to a bathroom, urge incontinence. Progressive frontal lobe impairment leads to the inability to recognize urinary urge, uncontrolled urination, and a lack of concern as the disease progresses. For suspected cases of normal pressure hydrocephalus, cerebrospinal fluid shunting is the first-line treatment. The most common type used to treat normal pressure hydrocephalus is ventriculo-peritoneal shunts, which drain cerebrospinal fluid to the peritoneal cavity. Summary of continence and micturition. Cerebral cortex, upper motor neuron. Cerebral cortex maintains continence by inhibiting micturition. Interruption of cortical input, for example, normal pressure hydrocephalus, leads to bladder hyperactivity, urge incontinence. Pontine Micturition Center, upper motor neuron. Pontine Micturition Center coordinates detrusor contraction and sphincter relaxation. Loss of Pontine Micturition Center input, for example, spinal cord injury, leads to neurogenic bladder. Sacral spinal cord, lower motor neuron. Sacral spinal cord relays signals to and from the bladder wall and erythral sphincters. Lower spinal cord lesions, for example, cauda equina syndrome, tethered cord, leads to bladder underactivity, overflow incontinence. Choice A. Cerebellar dysfunction can cause an ataxic gait, dysarthria, and intention tremors. Memory dysfunction and urinary incontinence are more indicative of cerebral impairment. Normal pressure hydrocephalus typically spares cerebellar function. Choice B. Compression of the reticular formation can occur with brainstem herniation, leading to loss of consciousness and coma. Choice C. Impaired basal ganglia signaling is characteristic of Parkinson disease, which can result in ataxia with a slow gait. However, cogwheel rigidity and resting tremor would be prominent, and dementia and urinary incontinence would not be expected until later in the disease course. Choice D. Spinal cord damage is a common cause of incontinence with gait impairment. However, spinal cord injury also frequently causes lower extremity weakness and is not associated with cognitive impairment. Educational objective. Normal pressure hydrocephalus occurs due to decreased cerebrospinal fluid absorption, resulting in ventriculo-megaly with normal intracranial pressure. This causes stretching of the descending cortical fibers, corona radiata, from the frontal lobe and contributes to the classic triad of symptoms, that is dementia, gait abnormalities, urinary incontinence. Loss of cortical inhibition of the sacral Micturition center leads to urge incontinence.